So a short update from our lab, and as you probably know, we are quite interested in pediatric GIST and wild type GIST, and specifically in identifying alternative pathways that are being activated in these subsets besides KIT signaling, of course. Our lab a few years ago has identified BRAF mutations in a small subset of wild-type GIST, and for the past 2-3 years, we've been taking a closer look to two other pathways, the IGF-1R and the succinate dehydrogenase complex, and I'm going to show you a little bit of data. We were puzzled by the dichotomy that we see between the pediatric GIST and the adult wild-type GIST vis-a-vis IGF-1R pathway activation. And you can see here on the left, the brown staining is the protein expression with the IGF-1R antibody in the pediatric wild-type GIST, as opposed to the adult wild-type GIST. Most of them show absolutely no expression for this particular antibody. And this is probably due to a upregulation at the RNA level. You can see here this bar chart showing very high levels of IGF-1R in pediatric GIST compared to very low levels of mRNA in the wild-type adult GIST. And it remains still of a puzzle. What is the reason, the genetic reason behind this? Since we've been taking a closer look and there is no copy number increase in the pediatric GIST. By FISH, we could see a 2 copy number for the IGF-1R gene, as well as there are no IGF-1R mutations in either pediatric or wild-type adult. We were able to study 15 wild-type cases sequencing the full-length cDNA of IGF-1R. But looking closer at the IGF pathway, we noticed, besides the fact that IGF-1R seems to be upregulated in the pediatric and young adult wild-type GIST compared to adult GIST, we have noticed a reverse pattern in the ligand, the IGF-2 ligand for IGF-1R, which shows marked upregulation in the adult GIST compared to the GIST that occurs in kids or young adults. And this differential expression can also be seen within the adult patients, that higher IGF-2 are seen in the wild type compared to the mutant, as well as a marginal overexpression is seen in the imatinib-resistant tumors. And a correlation between an IGF-2 upregulation and a high risk of disease or a high rate of metastatic relapse in patients with localized GIST have been previously reported by a number of papers. So we were intrigued by these findings, and we wanted to identify the mechanism behind IGF-2 upregulation in adult wild-type GIST. And when compared to other sarcoma types, really GIST stand out as having very high IGF-2 upregulation compared to a large number of different subsets or histologic types of soft tissue sarcomas. We had a prior experience of working with solitary fibrous tumor, which also was a tumor with high IGF-2 expression. And in that particular tumor type, we actually found a mechanism to explain the upregulation of IGF-2 by a pattern of loss of imprinting. So we took a very similar approach in a number of GIST samples, and we investigated 86 GIST samples for the pattern of methylation of the IGF-2 genes. And indeed, there was a very strong correlation between the high IGF-2 expression in the adult GIST and the hypomethylation pattern that was seen in 3 different CpG loci in the IGF-2 genes. So we concluded that indeed the increased expression of IGF-2 in GIST patients is really due to hypomethylation of this differentially methylated regions, which is most likely due to enhanced paternal allele transcription. Now, moving on to a different area, we presented last year some preliminary results on trying to identify new candidate genes on pediatric GIST, and we took the approach of very deep sequencing or next generation sequencing using the institutional platform, which is the solid a platform available here, which starts with a very small amount of GIST DNA, and the first step is the exome capture, which gets rid of all the non-coding, the intronic sequence, and then is followed by a very deep and parallel sequencing of the exons. So we were able to use this particular technique on 6 samples of pediatric and wild-type, pediatric and young adult wild-type GIST. You can see here the more detailed information about these 6 cases. Of course, they were all wild-type. They were all involving the stomach. One patient had Carney-Stratakis Dyad. They were 4 pediatrics, so younger than age of 18, and 1 young adult, which we define here as older than 18 but younger than age of 30. You can see that we tried to have a mixture of females and males. As you know from the initial presentation of Dr. Laquaglia, most pediatric GIST occur in female patients, but we tried for this particular trial to have a more balanced gender distribution, and you can see 3 were males and 3 were females. And the only mutation that was identified was seen in the only young adult sample, a 22-year-old male, that was found to have a germline SDHA mutation in exon 2. Dr. Laquaglia mentioned in his talk that the mutation in other members of the succinate dehydrogenase complex B, C, and D were identified in GIST patients. However, not that much information is available about the SDHA member. And you can see here there is a mutation in the tumor sample as well as a mutation in the normal sample consistent with a germline mutation that is composed of a stop codon, so the peptide is being truncated. And this particular patient, you may be interested to know what the clinical information was. He was a 22-year-old male, and he's still alive with disease 66 months after diagnosis. He developed liver metastasis quite early after his initial presentation, and he was treated with multiple TKIs listed here, and he's presently treated on regorafenib. After this particular result, we expanded the targeted SDHA sequences to a larger number of cases, including 11 pediatric and young adult wild-type GIST, and we identified one additional young adult patient that had a somatic mutation in the same SDHA exon 2. This was a 26-year-old woman with, of course, wild-type GIST, and she presented with bulky intraperitoneal and liver metastatic disease. The mutation was not identified in the normal tissue that was sequenced from this patient. We wanted to see what is the consequence of this mutation at the protein level, and the first 2 samples are from the patient with germline mutation, and you can see here almost complete loss of the protein, SDH protein expression. And Also quite interesting and intriguing somehow, the patient with a somatic mutation also had loss of SDHA expression by Western blotting. And this was further confirmed by immunohistochemistry, loss of SDHA expression in the SDH mutant patients, while SDHA protein expression was preserved in patients that didn't have this particular mutation. As previously shown by a number of publications, the other member of the succinate dehydrogenase complex, the SDHB, is typically lost in pediatric wild-type GIST. However, it is retained in KIT mutant GIST, and this is very nicely illustrated here. The succinate dehydrogenase mutations have been, of course, described for the first time in familial paragangliomas, and after that was implicated in the Carney-Stratakis Dyad. These patients, they develop both GIST and paraganglioma, and these patients with this syndrome typically have mutations in one of the B or C or D, but SDHA mutations have not been described in this particular syndrome. More recently, mutations in this particular complex have also been described in other cancers such as renal cancer, thyroid cancer. So it seems that the members of this complex play quite an important role in tumorigenesis. So we have few other things ongoing in our lab. We have similar next-gen sequencing on a group of imatinib-resistant patients that are 8-pair tumor normal samples. Of course, these are samples that we do not understand the mechanism of resistance. They lack second site mutation, so we are in the process of analyzing the data from the solid platform. And more recently, we wanted to explore a little bit the methylation profile of wild-type and pediatric GIST, the so-called the epigenetics changes that we think may play a significant role in this subset that may not have a specific gene mutation or a specific amplification or loss of a tumor suppressor gene. So probably methylation changes could play a role in wild-type GIST. And we took advantage of the Illumina platform that is available in our institution. I'm not going to go into details of this particular chip, but just to give you a sense of the number of these probes that are imprinted on this small little chip. 450,000 probes are being evaluated for each sample. In roughly about 50 probes are present per gene, and each probe more or less is present at every 500 to 1 kb distance. And of course, these probes give us information about the CPG islands that are present around the promoter on the enhancer sites, as well as the differentially methylated sites. And just very, very preliminary results. Peter Sung in our lab is working on this using the Partech software. In red here, this group are the pediatric GIST that were investigated. On the upper portion here are the adult GIST, and in between are a group of other sarcomas that were included as a control group. And probably, as you can see even from the back of the room, the difference between the methylation pattern in pediatric GIST is very red. That means hypermethylation compared to adult GIST, which is predominantly hypomethylated, and here in between different patterns in other sarcoma types. And when we looked at what genes are differentially expressed between the pediatric and adult genes, Some very interesting genes come up, especially for us that we work with the gene expression and the GIST signature. You can see here a number of genes that are highly expressed in GIST. DOG1, CD133, or prominin1 seems to be differentially having different methylation patterns between the pediatric and adult GIST. And this is just to give you an example how we are looking at the results. This is the ANO1 or DOG1, which is a important diagnostic marker used in clinical practice for difficult diagnosis together with KIT expression, of course. You can see every single bar here represents a probe that is being used on this methylation chip. And in yellow is the methylation pattern of pediatric GIST, which is very high compared to the blue pattern, which is the GIST samples with a particular KIT mutation. So very distinct hypermethylation pattern in the pediatric GIST patient compared to the adult mutant patients. And this is a correlation with the mRNA expression of the DOG1. In pediatric GIST, where we had hypermethylation, we have a statistically significant lower mRNA expression. And this is the same pattern with another gene, CD133, that is universally expressed in GIST. And this is the acknowledgement site. Of course, we work very closely with Peter Bessemer and his lab. These are the people that do most of the work in the lab, and of course our clinical collaborators. Thank you.